This is a video to help you just think about isoquants. All our goal really here is to think about all the different ways you could produce a product in general terms, and in our case, produce some kind of patient care. So we're always thinking about two different kinds of inputs. So in this case, let's imagine that our inputs are, we could either use relatively more prescriptions, or we could use relatively more therapy visits if it is some kind of mental health care. So let's suppose this is one patient, and let's suppose this is the shape of the isoquant. Then what that means is any of these points are different ways to serve that one patient, and they are all the choices of either, we're thinking from the standpoint of the producer or the provider. Of course, in the real world, the patient would have something to say about that, but we're just thinking from the standpoint of whoever is producing the care of the patient. So up here, let's suppose this is 5 therapy visits and 1 prescription. Then this means they're having both the 5 therapy visits and 1 prescription. Both of them are used. Over here, let's suppose it's 2 therapy visits and 4 different prescriptions. Then A or D are possible ways of serving that one patient. And if it's on the same isoquant, it means they're having essentially the identical amount of treatment benefit, and it's just a different way of getting to the same outcome. So there's other choices in here, B and C. So as we think about alternative ways of producing, we can think about if I changed to 3 therapy, if I started here at point D and I changed to 3 therapy visits in my depiction here, I could reduce the amount of prescriptions. So that shift requires giving up, or if it allows for giving up a prescription and adding a therapy visit to move from point D to point C. That's my isoquant. Now, higher isoquants represent just helping more patients. So there's different, it would take more of both of the resources in order to help more patients. This is the essential framework of an isoquant, and it only describes various methods of production, using various resources. And importantly, notice it doesn't say anything about how much the prescriptions, what they're valued at, or the therapy visits. It doesn't take into account the cost. It just takes into account what will work.